My generic name: 0.45% sodium chloride, 0.33% sodium chloride, 0.225% sodium chloride, and 2.5% dextrose in water. My chemical name is 0.45 NaCl, 0.33% NaCl, 0.225% NaCl, and D2.5W.
My brand name are normal saline or saline and sodium chloride. My therapeutic are nutrition solution and treat dehydration. I am categorized as C in pregnancy category.
For my mechanism of action, when a hypotonic solution is administered, it puts more water in the serum than is found inside cells. As a result, water moves into the cells, causing them to swell or even rupture. Sodium and chloride are major electrolytes of the fluid compartment outside cells, work together to control extracellular volume and blood pressure. Disturbances in sodium concentrations in the extracellular fluid are associated with disorders of water balance.
My pharmacokinetics route administration is through intravenous. Onset, rapid, peak, and duration are unknown. Metabolism, bioavailability of the component is 100%. Excretion are excreted by the kidneys with small amounts lost in feces and sweat. When medication is added to the following hypotonic IV solution, the overall pharmacokinetics of the solution will depend on the nature of the medicinal product used.
Replacement of cellular fluid and used to treat hypernatremia and other hyperosmolar conditions.
I am contraindicated in patients with or at risk of developing cerebral edema. Patients who are fluid overloaded should not receive crystalloid fluids. Special care is prudent when administering fluids to patients with congestive heart failure or those with significant renal impairment. Also, hyponatremia and hypochloremia. General edema and ascitic cirrhosis, also in pregnancy and lactating mother.
For my side effects and adverse effects, in the central nervous system, increased intracranial pressure, acute hyponatremic encephalopathy, headache, dizziness, restlessness, irritability, and weakness. In the cardiovascular system, diastolic or systolic heart failure, thrombophlebitis, tachycardia, and hypertension. In the electrolytes, hypokalemia, hyponatremia, and hypovolemia. For the eyes, ears, nose, and throat, corneal edema, and increased intraocular pressure. In the respiratory system, pulmonary edema. In the metabolism, metabolic acidosis and dehydration. In the miscellaneous, allergic reaction on an injection site, rash, and fever. Others, volume expansion with crystalloid fluids may cause iatrogenic fluid overload.
Nursing responsibilities before administering the medication. Before infusion, assess the patient's vital signs, edema status, lung sounds, and heart sounds. Assess for the mentioned contraindication to this drug to prevent potential adverse effect. Inspect visually for particulate matter and discoloration. Do not administer unless solution is clear, free from visible particles, and seal is intact.
Nursing responsibilities during hypotonic IV solutions administration. Warning on excessive infusion because it can lead to intravascular fluid depletion, decreased blood pressure, cellular edema, and cell damage. Be alert for adverse reactions and drug interactions. Do not administer along with blood products. Administer the minimum required volume to maintain volume homeostasis.
Nursing responsibilities after administration of the medicine. Monitor for adverse effect. Assess the patient vital signs, edema status, lung sounds, and heart sounds. Monitor for signs and symptoms of fluid volume deficit.